Here's a look at what we're talking about today. 75% of Americans have experienced chronic or recurrent pain, or maybe has a family member who has. We're going to talk with the doctor about the most common types of chronic pain and how to treat it with or without a prescription. September is National Pain Awareness Month. The annual cost of chronic pain, about $100 billion. Now, about 75% of Americans have experienced chronic or recurrent pain or may have a family member who has. So what are your options? Do you have to take a prescription to ease that pain? Here to help us with some answers, we have Dr. Todd here in the Lowcountry. Thanks so much for being with us.
Thank you, Tara. It's a pleasure to be here.
Now, looking at those statistics, that's pretty astounding that we know medical costs in this country are very high, but $100 billion just to treat pain?
That's right. And if you consider the global picture, there are more Americans suffering from chronic pain than there are from diabetes, cancer, and heart disease combined. The top two causes, and you alluded to that before, the top two causes are back pain. Sometimes sciatica is thrown in there with it, but that's number one. Number two is neck pain, and headaches are kind of added to that a lot of times, and that's number two.
So when we talk about chronic pain, I think when we can kind of wrap our head around diabetes. We know what it means to be hurt and to have pain, but how do you diagnose chronic pain? Where does this come from? What is that, I guess, the cause for the problem?
Well, that's a very good question. Short answer for that is we don't have a test for pain. We can't even measure it. We can measure heart rate, we can measure blood pressure, we can measure heart blockages, we can measure kidney function, but we can't measure pain. So it is difficult to do. We do know that pain's a good thing. It sends us to the doctor to first and foremost rule out serious and life-threatening problems. Beyond that, we're trying to figure out what's causing it and how to recover from it. But the human body, if you look at it very basically, we were all designed to fail at some point. As we fail, we become more likely to not be able to tolerate rebounds from periods of inactivity. So we really try to encourage people to stay active, exercise, aerobic activity, weight training, Pilates, yoga, diet. All those things can help reverse the decay of aging and tell your body, hey, I'm not ready to go down that slippery slope yet, or at least not as fast.
I think one of the things that frustrates me so much is, and I grew up being active. I played sports in high school and things like that. And, I've had a personal experience to know the importance of staying active and eating well. I've had family members who have been sick, but I feel like a lot of times it takes, and it shouldn't, but a lot of times it takes a tragic event or maybe a life-altering event to really say, okay, you know what? I am going to go for a walk this afternoon. I am going to incorporate more fruits and vegetables in my diet. I am going to cut out smoking. How can we really get that message to hit home? I mean, to me, knowing that all of us as a whole we're paying $100 billion a year in healthcare costs, we can save money and we can cut out pain if we do make those changes in our lives, right? Exactly.
If we just are aware of the fact that we're not as young as we used to be, you have to make a more concerted effort to do those things. And folks with chronic pain, to be honest with you, Tara, our objective is not to cure chronic pain. Our objective is to give patients with chronic pain a better quality of life. We always stay apprised of recent technological advances of treating pain, but maybe there is a cure out there. We don't know, but we want to try to reduce people's pain to an appropriate level, an acceptable level, and part of that is stuff that we do, as well as stuff patients do on their own with activity and exercise.
Of course, seeing pills here, and that's something that a lot of people turn to, whether it's ibuprofen or they have their prescription pain pills. We've got less than a minute left. One of the big movements that's coming up, we've got a big day tomorrow, the drug take-back day, prescription take-back day, to make sure that people, if there are unused medicines, they're not staying in their house vulnerable to children or getting mixed up and causing a danger, right? Tell me about this day.
That's correct. We all have these medications in our homes. You think about it, you get a dental procedure done. You go to the ER, you get some muscle relaxants. You get 30 pills, you take 10, 20 remain in your medicine cabinet. This is a huge problem in our country. It is costing, I'm most concerned about our children. Out of every day, 2,500 of our teenagers are using prescription drugs to get high for the very first time. Most of these kids now starting before they're age 15. It's being used, prescription drugs are being used more often for the first time than marijuana now, which is a huge, startling revelation of just over the past year or so. So we want to encourage people to get their medications, not only controlled substances like painkillers, Ritalin, Adderall, Valium, Soma, Xanax, those medicines, but also regular prescription drugs because we're worried about it getting in our water supply.
Right.
We want to get it off the streets get it taken care of the proper way so that we can protect our communities.
All right, excellent. Thank you so much for being with us. And we will let you know, Charleston, they're going to be collecting it at the police station downtown tomorrow on Lockwood Boulevard.
And Mount Pleasant.
And Mount Pleasant.
And the Sheriff's Office in North Charleston and the North Charleston Police Department.
Excellent. So you guys can clean out all those medicine bottles you don't need and dispose of them properly. Dr. Joy, thank you so much for being with us today.
Thank you for having me. Enjoyed it.
In tonight's big story, News 2's Cleve Bryan finds out about a national program aimed at cleaning out your medicine cabinet.
More and more legal drugs being used for illegal purposes.
There are more teenagers abusing prescription drugs for the first time to get high than those that are using marijuana for the first time to get high.
Dr. Todd Joy is a pain management specialist. He warns patients to keep an eye on their medicine cabinets.
Nearly 3/4 of all abused pharmaceutical drugs are obtained from family and friends.
A big part of the solution is getting rid of those half-empty prescription bottles so they don't fall in the wrong hands. Police departments throughout the country with the Drug Enforcement Administration for the first ever National Drug Take-Back Day.
They should bring them in because it's going to be a safe place to do it, and throwing them out or not disposing of them properly could be hazardous to other people's health or hazardous to the environment.
The event's Saturdays from 10 a.m. to 2 p.m. Just bring your old pills and dispense them in one of these containers. No questions asked.
Even if they're bringing in any other sort of illegal drugs, they're going to be taken in and disposed of properly here, and there won't be any questions asked with that.
A similar event last year in New Jersey netted thousands of pounds of prescription drugs, and organizers are now hoping for even greater participation.
This is a great opportunity to have a positive impact on public health and public safety.
According to the most recent National Drug Survey, 7 out of 10 drugs most commonly abused by teenagers are prescription medicines. Cleve Bryan, News 2.